Has given me the opportunity to share some, I think, very important points about fighting the pandemic with you all today. I picked this slide scheme so that it go along very well with the color of the university, Chulalongkorn University. Okay. I kind of an old man now, so let me talk a little bit, go back a little bit in the history. Back 20 years, today is 2022, back to 2002, 2002. We meet the first coronavirus that caused severe illness in human. Before 2002, we knew several coronavirus before, but all of those do not really cause severe diseases in human, just common cold, fevers, flu-like symptoms. But back in 2002, this is one of the very first coronavirus that caused severe illness in human. And from that day to today, it has been 20 years. But SARS was not the very first pandemic in, someone called it postmodern eras in public health or in medicines. One of the very first postmodern pandemic was HIV. And if anybody knew about the history of HIV, we recognize it back in 1980 something, 1980, and around the 80s we identified the virus. But one of the greatest wake-up call in human history that set us up so that we can kind of prepare for the pandemic to come was SARS outbreak back in 2002. The very first coronavirus outbreak caused diseases in human around 8,000 cases and about 774 deaths. If you calculate case fatality ratio, it was very close to 10%. That is, if there is 10 person infected, about one will die from that diseases. And it spread to about 29 countries. The history of SARS and history of this COVID-19 was somewhat similar. It started from China, but back in 2002, China did not notice the spread of the disease as quickly at this time. This time, I would say China has done a very good job on identifying the abnormalities and reporting the abnormalities to the WHO and to the world. Back then, they did not recognize the problem. The diseases spread within the communities, and then the patient went to the hospital and it spread in the hospital. One doctor from that hospital attend international meeting in Hong Kong. And the disease spread to medical doctors who joined that international conference and spread throughout Asia. The doctors who kind of start to blow the whistles back then was Dr. Carlo Urbani, the WHO staff working in Hanoi, Vietnam. He investigated the problem in Vietnam. He himself contacted diseases and flew to Bangkok, get treatment at Bamrat Naradun Institute of Infectious Diseases. Unfortunately, he died from SARS back in 2002. But with this kind of wake-up call, did we really do something about it? Or prepare something better than SARS outbreak or SARS pandemic back then? There are several countries that did not have authorities in disease control back in 2002. So after after SARS outbreak, several countries has initiated the programs of pandemic preparedness and pandemic response. WHO itself also issued the new international laws called International Health Regulation 2005. This happened just because of SARS outbreak back in 2002. If you look at international health regulation, it is a law and it's written that way. It has article number 1, article number 2, article number 3. But one of the most important things was its annex that called every countries to develop their capacities, 8 capacities, to fight 5 very important hazards. Those are infectious disease, zoonosis, food safety, chemical and radionuclear. And the capacity that each country has to develop include legislation, policy and finance, coordinations, and every country need to have what they call national focal point to coordinate, and also to coordinate within the countries and also with international communities. That is, if there is anything went wrong, national focal point is the one who have to report the incidents or the event to the WHO. And each country need to have preparedness capacity, surveillance and response, as well as risk communication. Every country need to develop its human resources, especially in epidemiologies, and also in laboratories. So these are 8 very important capacity that the WHO called for every country to develop its capacity. And later on, they add one more thing, that is point of entries. So after SARS outbreak, we have new laws, and every country needs to develop their capacities. The International Health Regulation was drafted and approved by all country members in 2005. It affected in 2007, and it asks every country to prepare itself and give 5 years for every country to develop this capacity. So everybody should expect that every other country should be ready for pandemic by 2012. But later on, they decided, well, 5 years may not be adequate, so they extend another 2 years. Once and twice. So in the end, from 2007 to 2012, 2014, and 2016, what happened? By 2014, 7 years after international health regulation was in effect, only 1/3 of the countries in the world said that they are comply with just basic level of IHR capacities. What does this mean? And this is all self-reporting, self-assessment. Thailand was one of the countries that said that we have capacity to tackle the pandemic or public health emergencies. What does this mean? It means that really nobody's really care about preparing themselves for public health emergency or for the pandemic. In around 2014, there are groups of countries leading by the US that saw that, well, the development or the developing capacity to tackle pandemic was going very slow. So they initiate the agenda called Global Health Security Agenda. In this picture, you can see that the US President Obama was at the podium. Actually, it was his initiative from the National Security Councils, from the NSA, National Security Advisors. So this is another agendas or another initiative trying to ask countries to develop their capacity so that we are prepared for pandemic. So they have three basic strategies: to prevent, detect, and respond. To prevent, instead of identifying 5 very wide areas like zoonosis, infectious disease, chemical, radionuclear, and food safety, GHSA focused only on infectious diseases, antimicrobial resistance, zoonotic disease, biosafety, biosecurities, this is for the lab, and also immunizations. Everybody should understand now why immunization are so critical in preparing for pandemic this time around. If we have very good system in providing vaccination to our citizens, then we are not going to have the kind of problem we are having today in Thailand. To detect, we need to have good national laboratory system, good surveillance, good reporting. This is reporting to the WHO. And also we need to have workforce development. Again, they focus on only epidemiologists. And for the response, they identify 3 very important areas: emergency operation centers, linking public health with law authorities, and also medical countermeasures and personnel development. So for the GHSA, initially, they have 11 capacity that every country who would like to join GHSA need to develop their capacity to fight pandemic. Later on, because it's a confusion between IHR and GHSA, both parties agree that they are going to combine those capacity into one, and we are going to call it IHR. And then they are going to evaluate every countries. They are going to go in and evaluate every countries using these 8 plus 8 capacities. IHR has 8 capacities, 5 hazard and 1 point of entries. They combine it with 11 capacity from GHSA, and then they put it into groups. So if you look at prevent, they are the combination between IHR capacity and GHSA capacity. We call these groups of capacity. Later on, this become indicators for country to develop their capacity as JEE. This is the third terms that I introduced today: joint external evaluation. And Thailand has already have a chance to have the groups from the WHO to come in and evaluate our capacities. I don't think I have those slides, those results for you, but I have the result of GHSI. So on the ways that we are working very hard to prepare ourselves to be ready for the pandemic. With one of the very first tests, the second coronavirus arrived in the countries back in 2015. 1 year after we reported to the WHO that we are ready for pandemic. One of the very first tests that we have. Fortunately, MERS was the diseases or the virus that did not really spread that good. So we have 3 cases of MERS, and we stopped it. We stopped without having any second generations. And this is not what I said. It is the late Dr. Prasad Thongjalan, who gave the interview to the newspaper, to Reuters, that we have done quite a very good job on MERS problem back then. And then back in 2019, 4 years after we have MERS, I think the team and every sectors in the countries back then worked really, really hard in developing our capacities. so that we are well prepared. And also, if there is anything happen, we are going to be able to respond to what happened as well as we can. So back in 2019, there was a group, actually probably around 2017 to 2018. There was a group from Johns Hopkins universities that they developed the indicator so that they can understand the capacity of each country that can tackle or can handle the pandemic situations. And they evaluate every country of how well their systems are. And they rank, they answer to question. The very first question, are there any countries that prepare for pandemic? Second question is that how well each countries are prepared for pandemic. So they evaluate every countries. It ended up that we score very high and we were ranked very high in the world. Let me see. Oops, go back one more slide. At that time, we ranked number 6 in the world. The first question, Johns Hopkins answered the first question that there was no countries that prepare for pandemic. No countries, even the US, the countries that has highest score. So Johns Hopkins University conclude that if pandemic happen, we will not be able to handle it. No countries can. That's their first answer. And the second answer was that there was only 13 countries that are categorized into most prepared, and Thailand was one of those. There were only 2 countries in Asia, as you can see in yellow, Thailand and South Korea that were categorized in most prepared. And most of the countries in most prepared categories are developed countries. Actually, I would say all of those are developed countries. This report was issued or was released in November 2019, just about a month before the first report of COVID-19. And on December 31st, WHO report 27 cases of unknown cause pneumonias or atypical pneumonias from Wuhan cities. And out of 27 cases has a history of visiting this large seafood market, or I usually memorize it at Wuhan seafood market. All of the 27 cases visit this market. During the course of the pandemic, one of the question I was asked very often was that how good I think China has done in reporting the occurrence of the diseases. Imagine this. Wuhan was the size of Bangkok, around 10 million people. And there were 27 cases of atypical pneumonias happened in the city the size of Bangkok. And they were able to detect this outbreak very, very rapidly, within a month. Just imagine that if this happened in Bangkok, will we be able to detect these 27 atypical pneumonia cases? So to me, I think they have done incredible job. Because I don't think we would be able to do it. So 31st, they report 27 cases of atypical pneumonia. So where were you on the date, December 31st? I remember it very well. I was in Chiang Rai, visiting the Than Washila Methi temples and having a pray, what they call New Year's prayer, right? Join those. Actually, I haven't been to the temple for quite some times. And after I visit the temples and this happened, I'm thinking to myself, I'm not going to the temple once again. And on January 3rd, they report a few more cases. So on January 3rd, they have a total of 44 cases of COVID-19. And back then, we evaluate our risk. There were 5 direct flights from Wuhan to Bangkok and a few more to Chiang Mai and to Phuket. So we declare our public health emergencies and activate our EOC. One of the very first activity was to set up a screening at the airport. And can you imagine what we have to do at the airport in detecting a new diseases that we don't even know what is the cause of illness? Yes. So during that time, we screen for fever. And if there is anybody presented at the airport with fever, we are going to send those patients to Bamrat Naradun Hospital. And then what? Test them for what? Our scheme back at that time, now I have these awake memories about this. We are going to do what we call serial testing strategies. So the first diseases we are going to test it for after we saw feverish patients is to test for what? For influenza. If they are influenza positive, then we're going to stop them. And second test was RP33, right? That is testing for respiratory pathogens, about 33 of them in one test. And if the result turn out to be all negative, or if there is any positive but not correlate well with the clinicals, we are going to do whatever the test the lab want to do. That is family-wide PCR for several types of viruses. It was very lucky for the countries, I think, that we activated our EOC back in January 3rd, because the first COVID patients walked through the gate of Thailand on January 8th. They was detected at the airport by our great epidemiologist. Actually, he diagnosed the patients before he know the result. So he very curious that this case is going to be our first COVID cases. So these epidemiologists at the port of entries follow the patient to Bamrat Naradun so that he can collect the specimen himself. And sure enough, that was our first COVID cases. And there are a lot of stories to tell about these first cases. But unfortunately, that was not topic of today. And then after that, something what I call the impossible happened. And something are all the first time, never seen before, and probably I hope I'm not going to see it again in my lifetime. The China declare the lockdown. What is the lockdown? They declare the curfew for the Wuhan resident for the whole 24 hours. You cannot leave your household on any circumstances. Have to stay at home at all time. You can leave the house twice a week to get the food for the whole families. So this is really a lockdown. In Thailand, we use the term lockdown quite a lot, but actually we have never locked down like Wuhan did. This is something impossible. I cannot imagine before this that Chinese government will do this. And then another impossible was Italy was the very first country outside Asia to have epidemics. Now we have 2 countries in 2 continents actually when we have the outbreak in Italy by the WHO facings. This is the beginnings of the pandemic. That is, we have 2 outbreaks in 2 countries in different continents. And Italy declared the lockdown as well and the closure of the borders. This is when China locked down. Well, okay, they are communist countries, but when Italy locked down, then you start to wonder what is going on. Even in the developed countries, the number of patients, especially the number of severe patients, overwhelm the health system of developed countries. Then everybody have to wear the mask like we did today. Back then, when the pandemic really started, even the WHO itself really said, no need to wear mask, only the one who have symptoms should wear the mask. So this is the first time. A lot of countries in Asia are very good examples for the West. And then come the closures of the borders for almost every country in the world. So BBC has one of the very funny titles. So COVID did not just kill human, they also kill the plane. So COVID, the BBC documentaries issue these documentaries, the virus that killed the jumbo jet. If you look at the statistic currently, I don't think there is any countries that fly Boeing 747 any longer. So it is the virus that's also killed the plane, not just kill human. I'm sorry, this slide. But what this slide said is that no countries control COVID the same way. No country control the COVID the same way. Because different countries has different resources. In Thailand, we choose these strategies because we have just this amount of resources. Even before the pandemics, our hospitals are already full. Don't ask anybody, just ask yourself here. What is the bed occupancies for Chulalongkorn University hospitals? What is the bed occupancy of your ICU? I can guess that is almost 80-90% at all time. So with no epidemics, with no pandemic, our resources are already stretched. So different countries need to have different strategies. And we have to really reevaluate the situation at all times. Now, from the first we are at the phase. If you look at the visual phasings, we have 6 phases of pandemics. And after phase 6, we are going to enter post-peak phase and then post-pandemic phase. We are currently around post-peak and entering post-pandemic. And there are already some articles from scientific journals or scientific magazines like Scientific American start to say, COVID is here to stay. As well as in the Natures also said that COVID is here to stay. So what is going to happen? We are coming the full circles of the pandemic diseases becoming the disease that we have to live with it. So every countries now have to think about the strategy how we can living with these diseases. So this was the second probably, but for us probably this is one of the very first pandemic that we have to learn to live with it. No, not the first one, the second one. The first one is probably HIV. That is entering the phasing of post-pandemic for quite some times. After we have antiretroviral therapy. And then when we said that the disease is endemic, nowadays the term that everybody is talking about, it doesn't mean that it's harmless. The diseases that public health personnel fear the most was influenza virus. We call it endemic diseases for quite some times. But we are so afraid of it. We have the system to track its mutation at all times. So that if when there is the new mutations, the new type of virus, we would detect it very quickly. Even just a small genetic drift or shift within the virus of influenzas, it can cause disaster already. COVID is going to be somewhat like influenzas in terms of the concept. Will there be another pandemic in our lifetime? In my lifetime, I have seen more than one pandemic already. HIV was my very first. Then a mini pandemic of SARS, mini pandemic of H5N1. And what else? Zika virus and H1N1 influenza pandemic. And this is the fifth one. So don't ask if there will be another pandemic. There will be. Just ask when it's going to happen again. And the odds was quite very high. In this slide, I just picked the one that I think significant. There are a lot more than this. SARS back in 2002, H5N1 in 2003, Zika virus outbreak, first in the Pacific and then in Brazil. In Brazil started in 2013. It caused the WHO to announce public health emergency of international concern. MERS, H7N9. During that time, a lot of Chinese died because of these low pathogenic viruses. Ebola and this COVID-19. So what we should do? The concept, the idea is already there. We need to do this. But what is the problem then? And another thing is we have to prepare, and we have to prepare for prevention, mitigations, preparedness, response, and recoveries. All of the scheme. And if you ask what we need to prepare other than JE indicators, there is a few more probably. Let's go back a little bit. So this is the score that I mentioned about, that we score 73.2 point, and we rank 6th in the world. And in last year's, Johns Hopkins reevaluated each country once again. So Thailand, the first evaluation we get 73.2, ranked 6th in the world. And the second evaluation we score less, that is we score only 68.2, but this doesn't mean that we are getting worse. But to me, the information is getting better and they understand the country better. Actually, between 2019 and the second report that they produced, I think we are a lot better than back in 2019. But we rank better. Now we are the 5th best country in preparedness and response in the world. There are 3 indicators that were identified outside: prevent, detect, and response. I will show you later now. So they are talking about the health system, about compliance to international norm and to risk environment. So we have to develop health capacities. We have to develop supply chain. We have to have countermeasure. We have to have healthcare access. And Thailand was very good on that. We are the models. We are the one who really implement universal health coverage. We have to comply to JE, to PVS. This is for zoonosis prevention. In risk environment, they evaluate the political and security risk, infrastructure adequacy, those kind of things. So these are, the framework is already here. What we need to do is really to do it. So the question of to answer the question of this talk is not that we don't know what we should do. We know it very well. Now it's time just to do it. So if you are a Buddhist, you may heard these terms, all know the ways, but few actually walk it. And if you are not Buddhist, I have another term that is quite very similar. Morpheus said there is a difference between knowing the path and walking the path. So this is the time for us to walk in the path. And we have done a very good job on this, but we have to continue to press on. We develop our national IHR committees that have several subcommittees and have several task force, so that we can tackle 5 hazards and develop the capacity that we needed to fight pandemic. We have frameworks, post-JEE action frameworks. We have developed that. We have our IHR strategic plan that mention about prevent, detect, and response, and also coordinations in the middle. We have strategic frameworks for disease prevention and control, so that we can keep on pushing on our good work. We have 20 years milestone. We have finished phase 1. We have to continue working on phase 2, 3, and 4. Actually, I have just one small joke to tell you. We present these concept frameworks to our minister a few years back, Professor Dr. Piyasakon. And he said that he liked everything that we present. But 20 years are too late. So you can see that we present that we are going to be the best in the world, in Asia, in the next 20 years. We said that no, we should be the top of Asia by the first phase, and actually we did. I think that is something that everybody who's working on this should be proud of. And we have the plan what priorities areas that we have to work on. We identified a few of them, and we are going to keep working on this and re-evaluate our priorities every once in a while. We have a plan to develop our epidemiologists, and one thing that we are very good of is having public health and animal health volunteers. We have more than 1 million of them, or we call OSMO as you know it, and OSMO working as health and also animal health volunteers. So when H5N1 or some zoonosis disease hit us once again, we are prepared for that. And this slide mentioned about one thing that just happened in the last 10 years. That is, in the early phase, we are focused on developing advanced epidemiologists, but we changed those strategy about 10, 15 years ago to also focus on intermediate levels. So we have intermediate levels, we have disease control unit training, as well as dangerous disease control unit train. And we finished training the disease control unit for dangerous diseases just about a month before COVID hit us. So in several sense, we are lucky, and I think in several sense, I think we are well prepared, and we have good person working on this. We developed our what we call biocontainment unit as one of our strategies, and this unit finished just about few months before COVID arrived. Everything just finished before COVID arrived. We have our preparedness and response capacity development plan. We have the framework for surveillance of EID. That includes surveillance in animals. And Chulalongkorn is one of the very important partners in this. Probably the only one. No, not the only one, because we have to mention about DLDs and the Ministry of Natural Resources as well. We have the plan to develop our point of entries and digital and information technologies. These are all our priorities. These are one of the examples of our data analytics project that we did. So if you saw this dashboard, it has capacity to do real-time analytics. It has the capacity, but the authority do not allow us to do so. There are reasons because they don't want people to confuse about the numbers. We develop our EOC so that we are well prepared, and we work with international agencies in these areas, both international agency as well as for the regional partners, especially for the ASEAN, and we are in the health plan for the ASEAN's health development agendas. So as I mentioned, we have come a long ways, but we still have a long ways to go. And I think everyone who worked on this preparedness plan and preparedness and response capacity should be proud of it. But getting there are long ways to go. I like this term. Getting there, we need a team of uncommon men and women. This is the pictures of the US national team, national hockey teams that won the Olympics against the odds. They beat the best team in the world, that is Soviet Union back then. And their coach said this: you can't be common because the common man goes nowhere. You have to be uncommon. COVID changed a lot of things, but I hope that we will have courage to fight against this COVID, just like these boys did. This boy living in Palermo in Italy, his grandmother was English woman. He cannot fly to his grandmother's. So what he did, he walked 2,800 kilometers so that he can spend just a few days with his grandmothers. So it has been said as a topic that 2,800 kilometers just to hug the grandma. So let us have the courage to walk through